afternoon, everybody. Thanks for joining us again today. I'll start, as I usually do, with the update on the COVID-19 statistics. I can confirm that an additional 18 positive cases were confirmed yesterday. That represents 0.7% of people who were newly tested yesterday, and it takes the total number of cases in Scotland now to 18,694. A health board breakdown will be available as usual later on, but my provisional information is that 11 of the 18 new cases are in the Grampian Health Board area, though I can't yet say if some or all of these are linked to the outbreak in Aberdeen. 6, I understand, are in Greater Glasgow and Clyde, and 1 is in Lothian. I can also report that a total of 265 patients are currently in hospital, confirmed with the virus. That's the same number as yesterday. And a total of 3 people last night were in intensive care with confirmed COVID, which is also the same as yesterday. Finally, I'm very glad and also very relieved to say that yet again, during the past 24 hours, no deaths were registered of a patient confirmed through a test in the previous 28 days as having COVID. So the total number of deaths under this measurement remains at 2,491. Although we are now reporting fewer deaths on a daily basis, that total does remind us of the impact that this virus has had on families across the country. And I want again to extend my condolences to everybody who has suffered loss. And as always, let me thank our health and care workers for the extraordinary work that they have done and continue to do. There are 3 points I want to cover today. We have had over the weekend, as you may have seen in the media, a number of small outbreaks of relatively low numbers across the country. But the most significant of these is the cluster that is currently being dealt with in Aberdeen. I can confirm that as of now, 13 positive cases have been identified as associated with this cluster, though, of course, that number may well yet rise. Each of the cases so far is linked to the Hawthorns Bar in Aberdeen, and I want to thank that business for acting swiftly and for cooperating fully with the guidance and procedures to contain the cluster. An incident management team led by NHS Grampian met over the weekend. It is working with the Scottish Government, Health Protection Scotland and local environmental health teams to trace contacts, inspect premises and do everything necessary and possible to minimise onward transmission. And I am very grateful for their efforts. We will, of course, provide more details as and when they become available. We've seen a few of these clusters now, and unfortunately, it's very likely that we will see more of them in the weeks ahead. And this particular cluster in Aberdeen is, if I'm honest, exactly what we feared when we reopened hospitality. And it's what I was talking about last week when I urged people to think carefully about just how often you need to go to a pub or a restaurant right now, and also about the care you should be taking while you are there. Of course, it's not just this incident in Aberdeen. Across the country and across social media, we're seeing evidence of people, and it is largely younger people, gathering together with little or no physical distancing in place. I've seen pictures on social media over this weekend that, not to put too fine a point on it, made me want to cry looking at them. I know what a hard slog it is every single day right now to try to keep this virus under control. That's a hard slog by people here in the Scottish Government, but even more so people working in Test and Protect and in our local public health teams across the country. It's a hard slog by the many businesses doing the right thing, and of course members of the public who continue to make very hard sacrifices right now. But every time one person throws caution to the wind and flouts the rules, the reality is they put all of us at risk, and they make the job of everybody working to try to control this virus that much harder. So I know this year has been really difficult, the most difficult most of us can ever remember. I know people have missed socialising, and I know that as we exit lockdown in a summer where we can't really travel, things can get frustrating. But I urge all of you to please follow the rules. Not just for yourself, although it is for your own health and well-being, but it's also about your friends, about members of your family, and also about the good of the country and the economy overall, so that we don't have to put restrictions on hospitality back in place. Because be in no doubt, if we have to do that, we will, because we will have no choice. The Test and Protect system is there to ensure that when these kinds of incidents do occur, they can be contained. And all the evidence so far suggests that this system is working well, but it is a bit like fighting forest fires. It takes enormous effort and enormous resource, and it is always a race against time. So we all need to help. Test and Protect is at its most effective when incidents like the one we're seeing in Aberdeen right now are kept at a minimum. So all of us need to continue to reduce the risk of transmission by denying this virus opportunities to spread. So please, I appeal to everybody, be careful. Remember to physically distance. I know it's really hard and I know it is the easiest thing in the world to forget, but remember to keep that distance. Wash your hands and hard surfaces, wear face coverings, comply with all of the different elements of the Facts campaign. Because it's by doing these things that we give ourselves the best possible chance of keeping prevalence of the virus low. And it's also how we best support Test and Protect and local public health teams and give them the best chance of containing outbreaks as and when they happen. Of course, when we do have outbreaks, it's also important that we try to learn lessons from them, and that's relevant to the second point I want to touch on. The Scottish Government has today published new guidance for call and contact centres. You'll remember that a couple of weeks ago there was an outbreak linked to a call centre in Lanarkshire. That centre was involved in essential activity, and throughout the pandemic, call and contact centres undertaking essential work have been able to remain open. And the staff at these centres have, amongst other things, enabled the work of our emergency services to continue. They've helped to support businesses, keep the lights on and the internet working, and they've provided financial and emotional advice to those who need it most. I want to take the opportunity to thank all of those involved in that incredibly important work. I also want to take the opportunity to thank all of those who are still waiting for their workplace to open. Non-essential call and contact centre premises are due to remain closed until at least the 14th of September, and we're continuing to advise people to work from home wherever possible. I know that makes things tough, and I really appreciate the patience of all of you who are in that situation and the sacrifices that you're making. The guidance we're publishing today will help to ensure that both now and in the future, contacting call centres can operate safely. It has been produced in consultation with employers and trade unions, and it takes account of the latest scientific evidence, as well as experiences like the outbreak in Lanarkshire. The guidance provides important advice on things like physical distancing, cleaning and hand hygiene, and it should further reduce the risk of transmission in the workplace. The final issue I want to talk about this today relates to the reopening of schools next week. We know that the move for children from nursery to primary school can be a big step. And for parents and carers, that move also involves additional costs for things like school uniforms, shoes, school bags and books. Last year, the Scottish Government established the school age payment to help with those kinds of costs. It's part of the Best Start grant, and it provides eligible parents or carers with a one-off payment of £250. It's aimed at people who currently receive certain benefits or tax credits, and it will be available to parents or carers of a child born between the 1st of March 2015 and the 29th of February 2016. It's important to note you don't need to take up a school place to get the money. Those who are homeschooling or who have deferred their child's start date can still apply. So if you think you might be eligible, please go to mygov.scot/benefits. That's mygov.scot/benefits for more information. Alternatively, you can call 0800 182 2222 and speak to an advisor, and we'll make sure those details are posted on the Scottish Government's Twitter feed later today. It's also worth noting that if you're eligible for the Best Start grant, you might also be entitled to free school meals or a school clothing grant, and you can apply for these by contacting your local authority. The basic point here is that there is help out there if you need it, and the school age payment is an important example of that. Last year, it benefited more than 18,000 families, and I hope that this year, at a really tough time for many people, it will provide even more households with that little bit extra support. I'm going to hand on to the Health Secretary in a moment and then to the Chief Nursing Officer, but I want to end, as I usually do, by reminding you once again of facts. These are the 5 key things all of us must remember in absolutely everything we do. Face coverings must be worn in enclosed spaces such as shops and public transport. That's F. A. Avoid crowded places, indoors or outdoors. C. Clean your hands and hard surfaces regularly. T. 2 metre distancing remains the rule. And S. Self-isolate and book a test if you have symptoms. Following this advice is actually more important now than it's ever been, because every step out of lockdown we take, the more opportunities we give the virus to spread. So we have to be extra careful and extra vigilant. Every day we see the evidence of what can happen if the virus gets out of control. Around the world right now, across Europe and parts of England, we're seeing significant flare-ups. And in many places, restrictions are having to be reimposed. None of us want to see that here in Scotland. I certainly don't. Incidents like the one in Aberdeen, though, remind us how fragile things are right now, and it underlines why all of us need to stick to these rules. If we do that, we will all play our part in continuing to suppress this virus, and we can then ensure that rather than having to go into reverse, we can continue to move in the right direction out of lockdown. So my thanks to everybody for your cooperation and your compliance. And please, as I said on Friday, just pause and think about how you're behaving in your own lives. And if you have let those standards slip, which would be, I guess, not surprising, then please take this opportunity to tighten up, because lives really do depend on it and we've all got a part to play. I'll hand over to the Health Secretary now to say a few words, and then to the Chief Nursing Officer before we move on to questions.
Thanks very much. First Minister, social care is playing a critical role in supporting people during this pandemic, and in May I provided £50 million to support the sector in its response to COVID-19. Today I'm pleased to announce that, following agreement with our colleagues in local government, I'm providing further support of up to an additional £50 million. So this additional money, now up to £100 million, will support social care providers with COVID-19 related costs, including reductions in occupancy levels in residential care, additional staffing or sickness costs, enhanced infection prevention and control measures, and PPE. I've been clear from the outset that we will meet any increasing need for social care as a result of the pandemic, and we will continue to work closely with COSLA, the local authority body, and with our NHS boards to make sure that they have the resources they require. This additional financial support, together with the other measures we've put in place, I hope is a practical demonstration of our commitment to supporting the sustainability and the resilience of the social care sector. I know it has been a hugely challenging time for social care staff and providers in dealing with what is an unprecedented situation. You have my sincere thanks for your professionalism, your compassion, your care, and the work that you do every single day.
As the First Minister has highlighted, the return of schools next week is a big talking point, I think, amongst children and families right across the country. So today I wanted to highlight the often unnoticed but essential role of the school nurse, who is just one of many wider team members who are there to support the education and the well-being of our children and young people across Scotland. Over the years, the school nurse role has grown and modernised, and I'm incredibly grateful to the nurses across Scotland who have been working in our schools supporting children and young people's health and well-being. Our school nurses are equipped with knowledge and skills in child development, which enables them to identify and intervene early to address any unmet health needs, which then goes on to maximise every young person's potential and, of course, support their emotional health and well-being as well. In the early days of COVID, advice was issued to boards and their partners on the importance of local planning and response to service provision for all families and young people, but in particular our most vulnerable young people in the light of school closures. So despite the school closures, the services have continued for those who are most in need, with school nurses working flexibly with a wide range of partners, but also with new technology, and which allowed them to keep in contact with young people. But where necessary, face-to-face visits have also taken place right through the duration of our school closures due to COVID. So in planning for the reopening of schools, School nurses are in an excellent position to meet the needs of children and young people, many of whom may be apprehensive about going back, maybe going for the first time, maybe some health or emotional needs that they have. And our school nurses are there to support that wide range of practitioners, and clearly the school teacher is there at the centre of all of that. And we have issued guidance recognising the central role of wellbeing of pupils and also school staff, and the consideration for those affected by health conditions. So the school team are ready and waiting to support all of the children and young people to go back to school next week. Our school nurses make a critical contribution to the network of services for children and young people and are uniquely placed to create a bridge into families and communities, and are very much looking forwards to being back with school pupils on their return next week.
Thanks very much, Fiona. We'll move straight to questions now. David Shanks from BBC Scotland.
First Minister, you mentioned the pictures of crowds outside bars in Aberdeen taken on the same day a cluster was revealed linked to an Aberdeen pub. Will we see additional restrictions placed on pubs, and how viable is the indoor pub trade when we're seeing clusters so close to the reopening of schools?
I don't want to put further restrictions on indoor hospitality because these restrictions were in place for a long time. That has an impact on people's livelihoods and the viability of businesses. So we've tried to strike the right balance, driving prevalence of the virus low, being able to gradually and carefully open up the economy and have test and protect in place to try to keep any outbreaks under control. But that's a delicate balance. I make no bones about it, and it doesn't take much for that to be thrown off kilter. And if that happens, then we will, unfortunately, it's not something I want to do, we will have to consider further restrictions up to and including perhaps the further shutdown of premises like pubs and restaurants. And that's the last thing I want to do. So I have to appeal to people, if we're to keep this delicate balance, then we all have a part to play in that. I've made no bones about the fact that the return of schools, for obvious reasons, the well-being of our young people, is the priority of the government, and we will not allow that to be compromised if taking action elsewhere can protect that objective. This is, and it's something you've heard me say so many times, and not just me, many people have made this point right since the outset of this pandemic. Getting through it and remaining in a safe position while this virus is out there is a collective effort. I know how hard people in government are working, literally day in and day out, long hours. It's a hard slog. That is even more the case for people working in our public health teams. When something like the Aberdeen cluster happens, you have no idea the amount of resource and effort and hard work it takes to keep that under control. So all of us have a part to play to try to minimise these outbreaks and keep this virus where we need it to be. And if it starts to run out of control, if one of these clusters can't be contained, because it's always just a race against time, then we'll be back in a very, very dangerous position, and the government will have to act, because I'm not prepared, and I've been pretty blunt about this all along. I'm not prepared for lives to be put at risk because we allow the virus to flare up and don't take action to try to contain it. So we're not there yet, and I hope we don't get there, but that involves all of us. It involves each and every one of us. I keep asking you to think about every room you're in, every other household you're meeting with right now. Assume COVID is there with you, because it may well be, and just think about how you stop that jumping. When it jumps from one person to another, one household to another, then it's easier for it to jump from there to another, and it will spread very, very quickly. And we're the only, all of us are what stands in the way of it, and it takes all of us to do the right thing. So please, please, please do the right things. Stephen Brown from STV.
Good afternoon. First Minister, based on the cluster in Aberdeen, and it would appear the more cases that you've seen today in Grampian, how much more likely do you feel it will be that we will see targeted very local lockdowns, in particular, as you say, to try and get schools back next week?
These things are kept under ongoing review, and there's no simple answer. It's a good question, but there is no simple, one sentence answer to that. As long as we are dealing with clusters and we are satisfied that the clusters are under control and that the chains of transmission are being broken, then we're less likely to have to think about measures which would be anything like a local lockdown. And remember, local lockdown can, encompass a whole range of different measures. It tends to be a blanket phrase used for a lot of things. The danger is if these clusters get out of control, and despite the best efforts of Test and Protect and people in our local teams, that they spread further and seed wider community transmission. And that's the big danger, and that's what we are working so hard to try to avoid. And we judge that, and we will judge that on a daily basis. I don't want to have to impose any further restrictions on how people live their lives. There are still restrictions in place as part of lockdown, although we're out of it. But equally, I won't hesitate, because we have seen over the past 4 months the damage this illness does to people, and we can't allow that to happen. So, as I said, it's the most delicate of balances, and we've all got a part to play in trying to keep it under control. And, it's a bit like anything else. Prevention is better than cure. So every one of these clusters, effectively what you've got is a local public health team trying to cure it by jumping on it and keeping it under control. But if we don't let them happen in the first place, then they don't have to do that. And that is down to us. It is like forest fires. If they don't start, then we don't have to try to control them. So all of us, we're the first line of defence in this. Test and Protect is in there as the next line of defence, but we are the first line of defence. So every time one of us, and I include myself because I'm as, it's as possible that I will breach physical distances as anybody else, although I'll try not to. But each one of us has to make sure we're not breaching that defence. And that's why it really does come down to all of these basic steps that we're asking people to take. Fraser Nicholl from Original 106.
Thank you, First Minister. Good afternoon. Today sees the Eat Out Help Out scheme being launched, and you've previously encouraged people to support local businesses. On Friday, though, you said we should consider if our trip to the pub is necessary. And with this new cluster in Aberdeen, can I ask you if people should be supporting their local pubs and restaurants or avoiding them?
So again, it's a delicate balance, and I wish I could just say, pour into the pubs and restaurants to support our economy, because I want to be able to support businesses, but we have to do that carefully and we have to do it safely. So I'm not telling people not to go to a pub or a restaurant, but I am saying think about how often you do that right now, and most importantly of all, think about what you do when you're there, the steps you're taking to try to keep safe and keep other people safe. So it's not an either or. Life would be a lot easier for all of us right now if we could just, go all in one direction. But I keep saying, and you'll hear me say this a lot today, this is a fragile and delicate balance, and it doesn't take much to throw it off kilter. So by all means, the scheme that comes into force today, that the Chancellor announced a few weeks ago, the Eat Out and get money off your meal, by all means, take advantage of that. But if you are in a restaurant, make sure you are rigorous about complying with all the rules. And if you go to a place and you don't think they are complying with all the rules, go somewhere else. Literally, this is down to all of us. We're only as strong as the weakest link right now. If one of us lets our guard slip, then this virus gets through, and we all pay the price for that. Never before in my lifetime has the need for collective action and understanding that our behaviour as individuals affects everybody being more important. And I really do. If I sound as if I'm pleading with people, it's because I am pleading with people, because I know the consequences will be dire if we let this thing get out of control again. Tom Eden from PA.
Thank you, First Minister. Good afternoon. Following on from those remarks about the delicate balance required to allow schools to return safely, is the hospitality sector the first in the firing line if there's going to be a trade-off? And can you also give some indication of how much notice you're going to give to sectors forced to lock down again, and whether any additional support is being considered for businesses affected by any re-imposition of lockdown?
Look, I will completely reject any talk of a firing line. Although we can all, by letting our standards slip, help this virus to spread or allow it to spread, none of us are to blame for the fact that this virus is out there. So I don't want to have that kind of language, nor do I want to give the impression that it's only hospitality that is a risk right now. there are obvious reasons why hospitality poses risks if we don't comply with the guidance. But the recent outbreak in Inverclyde, started with a pharmacy, for example. So it's not just hospitality. All premises, particularly indoors, but there are risks outdoors as well, pose risks if we don't comply with the guidance. It's that simple. And again, it comes down to all of us. I don't want to contemplate having to stand here putting more restrictions on hospitality or any other sector of our economy, but if that proves necessary, then we will have to do it. But the way to avoid that is all of us trying to stick to the rules right now. And in terms of how much notice, again, I can't give a blanket answer to that because it would depend on the circumstances, it would depend on the risk that we thought we were trying to contain. But let's focus on, let's not, and I know, again, it's a difficult balance for me to strike here because I'm being pretty blunt in the warnings I'm giving about what could happen, but let's not assume the inevitability of that. Let's focus right now on how we stop these things happening so that I'm never having to stand here saying pubs are shut again or being asked to operate under more severe restrictions. And it comes down to all of us. If all of us play our part here, we minimise all of this. And that's just the reality. So let's not just go forward thinking, well, at some point we're going to have greater restrictions. We've all got agency and power right now to stop that happening. Daniel Sanderson from The Telegraph.
Thank you very much, First Minister. If this pub in Aberdeen was following all the guidelines as all the indications suggest they were, does that mean the guidelines are too lax? And if short of shutting the entire hospitality sector down, will you consider revisions to those guidelines, perhaps moving away from the 1 metre exemption? And also, if I may, just on the Eat Out to Help Out scheme, isn't there a danger that the public are getting mixed messages here? On the one hand, we've got you telling people to think carefully before going to a restaurant on the same day that a scheme is being launched explicitly designed to get people into restaurants. So what are your thoughts on that? Thanks.
Well, I'm not going to, obviously the Aberdeen situation is still being dealt with and under investigation, so I'm not going to talk about the specific pub in too much detail. But remember, it's not just about pubs complying with the guidelines. That's important, but everybody who's in a pub has to comply with the guidelines as well. A pub could be doing everything it's meant to do, but people in the pub don't stick to the guidance. So in a situation like this, environmental health will visit, they'll inspect premises, they'll give advice about whether there's ways in which performance against these guidelines can be tightened up. But again, none of us here should think it's somebody else's responsibility. It's all of our responsibility, and I think that's the key point. And in terms of would we look at tightening up guidance if we thought that was necessary? Yes, we would. There's all sorts of things we've got to keep under review. We've got to be smarter than this virus, and we've got to operate in a way that denies it what it will do naturally, which is spread as far and as fast as it possibly can. And we've got to be one step ahead of it at all turns, and that's why we have to keep everything under review. In terms of the messaging, I stand here every day because I want people to hear the message and the advice that the Scottish Government is giving. It isn't a case of one thing or the other. I know how important it is to support sectors of the economy that have had such a tough time. So schemes like the Eat Out to Help Out, that's an important part of it. But if we all, in taking advantage of that, forget the other things we have to do here, then that's when we run into difficulty. And, I listened, as many of you will have done, to the Prime Minister on Friday talking about the current situation in parts of the north of England, where it sounded to me as if he was given a very sensible message as well about being careful and being cautious. And that's, I've used the phrase umpteen times already today, but it is really what we have to bear in mind. This is so delicate, and if we keep that balance right, we might get through this without more restrictions, but if we don't, we won't. And it is down to all of us. We've all got a part to play. Scott McNabb from The Scotsman.
Thank you, First Minister. You alluded earlier to the fact that these clusters and outbreaks that we're seeing are exactly what you feared when pubs reopened and hospitality reopened. Can I ask, though, are they within the bounds of expectations Are you satisfied that these are under control? Given we're a fortnight on from the full reopening of hospitality, are the full numbers feeding through, if you like, the full impact of that reopening now feeding through, and are you satisfied that's under control? And also, if I may, what impact would this have on moving to stage 4, these localised outbreaks that we're now seeing?
In terms of, are we seeing anything right now that we wouldn't have expected to see? Probably not overall. I hesitate to say this, particularly with the Aberdeen cluster, because it is still being managed and there may be more cases associated with that. So I hope it is under control, but I think it's probably too early for us to say that with certainty. There's smaller sort of clusters in other parts of the country that are being dealt with right now too. But thus far, the clusters that have materialised, Test and Protect and local teams have worked very effectively to keep them under control, and that's what they'll continue to do. But you know, it is a huge effort for them to do that, and they will do that as often and for as long as necessary. But our objective should be to stop these clusters, or do everything we can to stop these clusters happening in the first place, and that really is what I'm asking people to do. Scott, you had a second part to your question, which has slipped my mind.
Of lockdown exit.
Sorry, I didn't hear you there. Oh, phase 4. I remember, it's come back into my mind. Phase 4. The criteria around phase 4 in the route map, if you look, you can go into the Scottish Government website and still read this for yourself. But one of the criteria we've got to satisfy ourselves of to go into phase 4 is that the judgment is that this virus no longer presents a significant threat to public health. And we're not there yet. We're not, in my judgment right now, and certainly in the judgment of the Chief Medical Officer who gave us his assessment of this last week before we made the decision on sticking with phase 3. We're not anywhere near that right now. Now, I don't think I can say any more than that right now. But I said in Parliament last week that we would stay in phase 3 for now. And when it comes to the next review in, well, just under 3 weeks now, it is quite possible that at that point we will stay in phase 3 then as well, because this virus is still a threat to public health, and until we are in a different position in some way, that is likely to be the case for the foreseeable future. Tom Peterkin from the P&J.
Good afternoon, First Minister. You just said that there may be more cases linked to the Aberdeen cluster, and you've reported today that 11 of 18 new cases are in Grampian. I understand that you said that you don't know whether they're linked yet, but I wondered, what is the likelihood that these new cases are linked to the Aberdeen outbreak?
I think it's probably not helpful if I speculate in that, Tom, before I have that detail. What you've got, when you're dealing with an outbreak, we'll often confirm cases associated with it. So some of the 13 that we have already, now I started up by saying I wasn't going to speculate, I'm immediately speculating, but just to illustrate this, some of the 13 that we have already announced may be in these 11 that are only being reported through this route today. There may be others in the 11 that will add to that 13, but the investigation of these cases is underway right now, and it probably wouldn't be helpful for me to say more about that until I've got a greater analysis of them, which I hopefully will have later today. Tom Martin from the Express.
Hi, thank you, First Minister. Just briefly, is there a level of community transmission that will get you at what point you would have to consider calling last orders or reversing things? And briefly, if I may, just overnight there's been an announcement of 90-minute tests south of the border. I just wondered, are you looking at bringing those here, or what role they may play up here?
The Health Secretary may want to say a word about the test. We welcome the announcements around the 90-minute tests. We're in discussions with the UK government. There will be a portion of them for use in Scotland, but we're having these discussions right now. We will also want to make sure that our own clinical advisors look carefully at the accuracy and the efficacy of these tests. But anything that speeds up the diagnosis of COVID and then allows the whole contact tracing procedure to be speeded up is certainly welcome. I'll hand over to Jeane on that in a sec. But on the first part of your question to me, look, I've hesitated to give an exact figure of what would trigger action, because we have to see these things in local context. We have to take a whole range of different things into account. But we monitor on an ongoing basis a whole range of data to try to make sure that we've got a handle on whether there is community transmission increasing or whether what we're dealing with are contained clusters. And these can be difficult conclusions to draw for our public health experts sometimes, but that work is ongoing and will continue to be ongoing for a long time to come. Jeane.
Thanks, First Minister. I want to make a couple of points about the 90-minute test. As the First Minister said, we're currently in discussions with the UK government, and we will receive a population share of those tests. But the important point about them, they certainly offer advantages, but we need to be sure, and this is where our clinical and scientific advisors will assist us, we need to be sure that the 90-minute test is as good as the current PCR test, the one we currently use with the swabs. And it's good in two particular respects. You'll have heard the Chief Medical Officer talking about this on more than one occasion. It's very sensitive, so it detects the coronavirus in you as against any other viruses that you might have. And it detects then, it's very specific in not only identifying the coronavirus, but identifying this one, COVID-19. So it is very particular and focused and reliable. The 90-minute test, if it meets that criteria as well, is really helpful to us, particularly as we look towards the autumn and the winter and the flu season, when people may be ill from flu or it may be COVID-19, and being able to quickly identify which it is clinically important to be able then to treat people in the right way. So we'll keep up those conversations. Our clinical advisors will advise us, and as we move on this, we'll make sure that people know.
We already have what we call point of care testing or rapid assessment, where specimens can be taken away, given to labs and get very rapid results back. And where we find them incredibly helpful is when we're admitting people into our hospitals, and then we know what kind of isolation and what kind of treatment they need. And as the Cabinet Secretary has outlined, once we have a confidence in the reliability of the tests, then we would expect that both within communities, but also when admitting to hospital, and it keeps everybody safer. So we look forward to seeing this new development coming into place.
Thank you. Mark McLaughlin from The Times.
Good afternoon, First Minister. A few months ago, I read a quote from the public health advisor in Sweden, and he said that in the end, everyone will end up in the same place, lockdown or no lockdown. And we saw in the ONS stats last week that Stockholm has had a very similar curve to Glasgow, despite having completely different public health measures, no lockdown in Stockholm. Do we understand any more now about how Stockholm managed to flatten its curve in a very similar fashion to Glasgow without a lockdown?
I'm not able to stand here and give you much insight into Stockholm, I'm afraid. I'm much more focused on Glasgow and other parts of it, and actually over the weekend, Aberdeen and Scotland. So, our advisors look at all of the global trends, lessons. We try to look at what other countries have done well, perhaps what they haven't done so well, and learn from that. And other countries will be looking at us as well. But I'm not able, I'm afraid, to give you much of an insight into Stockholm standing here right now. If there's more information we can provide later, happy to look at doing that. Michael Blackley from the Daily Mail.
Thank you. Good afternoon. You said in your previous answer that a move to phase 4 will only happen if the virus is no longer a significant threat to public health. Is it realistic to hope that we'll actually get to that stage without a vaccine or treatment, or could we potentially be waiting several months to reach that stage? And also, could you clarify exactly what would be required to happen to cause a wholesale move back to phase 2? And do you think that that is a risk?
Look, I would love to stand here right now and give absolutely cast iron definitive answers to these questions, and I absolutely understand why journalists want to ask them, but I'm just not able to do that. I fervently hope we don't have to go back to phase 2. Clearly, if you think about what the prevalence and spread of the virus was in phase 1 and 2, then if we got back to those levels, all of these things would have to be considered. But I really don't want us to do that, which is why I'm standing here saying the power is in the hands of all of us to try to prevent that. And on the could we stay in phase 3 for quite some time? Again, that's not impossible. I can't say for certain because I don't have a crystal ball that allows me to see exactly how this virus is going to unfold over the next few weeks. So we have to judge these things as we go and take the safest, most precautionary decisions that we can to try to keep that delicate balance that I've talked about many times before. What we do know is that if we get an effective vaccine, then that puts us in a much stronger position than we're in now. There's a lot of positive signals about that, but we are not there yet. Similarly, there's lots of positive signals about some more effective treatments for COVID, but we're not there yet. So we just have to keep navigating our way through this as best we can, giving certainty, or as close to certainty as possible when we can, but also, as I've tried to do from day one, being honest when I just can't give people that certainty because the behaviour of a virus is pretty unpredictable. Alistair Grant from The Herald.
Hi, First Minister. Thanks very much. Devi Sridhar, the public health expert, one of your advisors, has said face covering should be mandatory when universities return, while all students should be tested on arrival and 5 days later. Are these moves you're considering?
We're looking at the situation with universities right now. Devi Sridhar, as you know, is on our advisory group and is a very valued advisor to the Scottish Government. So we will, sort of confirm the measures that we want universities to put in place when we've taken those decisions. But there are discussions ongoing about all of these things. Tom Magner from Carers World Radio.
Thank you very much indeed, First Minister. A couple of weeks ago, Oxfam Scotland warned that if carers weren't put at the heart of recovery, it would leave them in poverty and be a betrayal of their critical contribution to society. You've shown an understanding of unpaid carers and those juggling work and care at home when I previously asked about this subject. So are you disappointed by what Oxfam said? What action have you taken since their remarks? And in light of those points, what can you now say direct to our viewers?
I'm going to hand over to the Health Secretary, who, of course, is, in terms of the government responsible for carers policy. Carers will always be really central to everything we do, and that was true pre-COVID, and it will be true as we go through and after COVID. As with every other aspect of that, there are some difficult, challenging decisions for us, but this country owes an enormous debt of gratitude to unpaid carers, and we try to repay that debt, although I don't think we can ever fully repay that debt, but we try to do it not just in words, but through the carers allowance supplement and other practical measures we put in place, and we'll continue to look at what more we can and need to do. But Jeane might want to say more right now.
Thanks very much, First Minister. As people watching, I hope knowing that, and I know that you do, Tom, we've worked very closely and we continue to work very closely with carer organisations, the organisations that help and support carers through the early phases of the pandemic to make sure that we were responsive to the immediate needs that people had. So, for example, for their own personal protective equipment and being able to access that, but also being able to access support for their own well-being. As we continue to deal with this virus and this pandemic, and albeit in a different phase, but nonetheless it's still there, and we look at how we remobilise and recover our social care services and our health services, then we'll continue to work with those organisations because they represent the voice of carers for us, and I'm always open to hearing more about what more they think we can do that provide practical support to them in the job that they do, which is so vital and so important, and in so many ways is a job that we can never repay or thank them enough for.
And the final question today is Christine Lavelle from The Sun.
Thank you, First Minister. It was just again on the risks of around indoor hospitality in the cluster in Aberdeen. You mentioned earlier that it's mainly younger people that you've seen in images who are failing to socially distance. I just wondered, is there anything you might do to tackle that? For instance, would you consider a policy of banning under 25s from pubs if it seems like it's older people that are better abiding by the rules?
No, I really don't want to have to do that at all. I'd rather not have to put any restrictions like this on, which is why I'm making the point that we all have the power and the agency. We can't necessarily stop every case of this virus because it is an infectious virus, but all of us have the ability to try to minimise the transmission of it. So, you know, the buck stops with all of us. Ultimately, of course, it stops with me in terms of the overall response to the virus, but actually it's down to every single one of us right now. And I'm not picking on younger people, but you know, clearly younger people are more likely to be frequenting pubs. And one of the points I think we made on Friday, which I'll just take the opportunity to reiterate, is that young people are not immune from getting this virus. The total number of cases over, well, as of Friday, this previous 7 days, I said this on Friday, half of them had been in the 20 to 39-year-old age group. So young people can get this virus, do get this virus. Yes, we know older people are more susceptible to becoming seriously ill or dying, but it doesn't mean that if you're younger, there's no chance of you getting seriously ill or dying. You could get one or other of these things. And of course, even if you don't suffer very serious symptoms yourself, if you get the virus, you could pass it on to more vulnerable people, your grandparents or your parents or people that you're just coming into contact with elsewhere. So, you know, we've all got a big part to play here, which really takes me to my final point today, which was, because we've concluded the questions for today, and my thanks to Fiona and Jeane and to Jill, our BSL interpreter, and to all the journalists. But my main thanks that I want to end on today, because I see up close just how hard they're working right now, are all of the staff working through Test and Protect and in our local public health teams, particularly those who've been dealing with outbreaks. It takes an enormous, almost unimaginable amount of effort to try to break the chains of transmission when we have clusters. And I said earlier on, and it's really where I want to end, that, you know, in some respects, they're the second line of defence, and it's really important that they're there, but we're the first line of defence. Every single one of us as citizens right now is the first line of defence, and we will only be as strong, if you think of it as a fence or whatever, we're only as strong as the weakest link. So just all of us need to think about our own personal responsibility, because every time one of us breaches one of these rules, this virus can spread. And if it spreads from one person to another, then it's got a chance of going further than that. And, you know, it's taken a lot more effort then on the part of all these people I've mentioned to keep it under control. So I will end, as I always do, with the reminder of facts. Just familiarise yourself with this. And everywhere you go, assume COVID is with you and think about all of these steps that we're asking you to take to try to keep it under control. So that is F, face coverings, shops, public transport mandatory, but you know what? Any enclosed space where physical distancing might be more difficult, wear a face covering. A, avoid crowded places. Some of the pictures I saw on social media from the weekend were of people crowding outside pubs with no physical distancing. So whether it's an indoor crowded place or an outdoor crowded place, the risk is greater. Please avoid it. C, clean your hands regularly and clean any hard surfaces that you touch after you touch them. T, 2 meters distance. This is the one I think, you know, most people are possibly forgetting most often. So 2 meter distancing with people outside your own household. And S, self-isolate and book a test if you have any symptoms. So that's a cough, a new cough, a fever, or any loss of or change in your sense of taste or smell. You can go to the NHS Inform website to book a test, because it's by doing that that you then allow Test and Protect to kick in and try to break any chains of transmission. It's a pain having to live like this. I absolutely know it. and none of us want to have to do it for any longer than necessary. But it is necessary right now. And if we let our guard drop and if we stop doing these things, then all of these things that I've said throughout this briefing today that I don't want to contemplate, putting restrictions back on or moving backwards in the route map, unfortunately, all of these things will become possible and maybe even likely if we allow this virus to take a grip again. And if you think I'm just standing here with the doom and gloom that I know probably I sound as if I'm indulging in quite often, don't just listen to that. Just do a Google search. Look at what's happening in Melbourne and Victoria in Australia right now. Look at people in the north west of England living under more restrictions. You'll find many other countries where this virus has taken hold again and they've had to go backwards and reimpose restrictions. So let's do everything we can to try to avoid getting into this position in Scotland. We've done collectively such a good job in getting to this position. Let's not take the risk of going backwards. Thank you very much. I will stop my rant at that point. Please bear with me for that. And I look forward to seeing you back here tomorrow at 12:15. Tomorrow, of course, for young people across the country is exam results day. We haven't had exams this year, but tomorrow is the day when young people will find out how they've done this year. Good luck to everybody who's waiting on those results, and we'll be able to talk more about them when we're here tomorrow as well, of course, as the latest situation with the virus. My thanks to all of you for now.